Somewhere in the middle, try to find myself again. But life is one big riddle of the future and what's been. Guess it's the way it goes, and I will never know why you let me go. Look to the left, look to the right, nothing can stop me in the night, like I am leaving all the bad stuff and trying to remain so strong. I know it's good if I'm wrong. I got it, I gotta go, 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 running to better times. Go, 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 from my emotions I'll go, 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 running to better times, to better times, to better times.
Good evening, everyone. Welcome back. We are here again tonight for another episode of To Be Black and Female, brought to you by the Luv Health Co., which is a fantastic digital comprehensive wellness platform created by Elle Hoffman and Dylan. So tonight we have two fantastic ladies joining us, and I'll let them both introduce themselves, starting with Samira this way.
Hi, I'm Samira Williams. I'm a licensed psychotherapist and trauma recovery coach, also an NLP practitioner, and I'm happy to be here tonight.
And Q, I'm not sure if Q's having any technical difficulties, but if not, I'd love for Q to give a quick intro.
My name is Q, and I am the owner of a creative service company, Brewing Arts, and and I am here to give my opinion and insight on what it is to be a Black woman in America.
Fantastic. Thanks, Q. And once again, I am Lexi, the VC. I'm a venture capitalist based in Cincinnati, Ohio, and a health and wellness enthusiast. So I think tonight we're going to talk about one of my favorite things, which is partially health and wellness. Since we all last gathered, our fearless leader has contracted COVID-19. Thoughts and prayers. It's been a very interesting week in terms of kind of the intersection of health and politics, as lots of things have come out about that. So I'm just interested, kind of, what were your first takes on that news when you heard it, ladies?
My first take was that it was fake news. That was my first take, if I'm honest. And here's the thing. Nobody wishes anybody ill will, and I certainly don't wish it for 45. And I want him and his family to be well. However, I also feel like there is great irony in not just him denouncing health protocols that we know are wise: mask, hand washing, cleanliness, disinfecting, following CDC guidelines, being in smaller groups, quarantining when need be, decreasing activities that are high risk. All of these things we know are going to help fight the spread, protect ourselves, each other, and the folks that we are around. I feel like it's very frustrating when he has kind of co-signed these people who feel like masks are a way of social control. And I also feel like because there's not an effort to bring about unity and to bring about collective moving forward in safe and healthy ways, it's hard for all of us who are doing the things, wearing the mask, staying inside, avoiding activities, not visiting family, not visiting friends, not attending things that are important to us to help slow the spread. And for him and his camp to kind of be anti that. And then this happens. It's like, this is what we're talking about. If we could all just do our part, we would decrease the curve. We would help improve the stats and everyone's outcome. So my frustration is that when half of us are doing what we know to be safe and 40 or more percent of people are making this into something that it's not, it's hard to come together about how we move forward in safe ways that are proactive and that promote the goodwill of humanity.
Absolutely. Q, what are your thoughts? What were your first thoughts? Okay, maybe Q's having some technical difficulties.
Thoughts, love?
We'll give her a moment to gather her thoughts. So, one thing I'd love to talk about a little bit on this issue is COVID-19 disproportionately is affecting communities of color. COVID-19 is also, unfortunately, leading to higher fatality rates in communities of color. I have some theories on that, but what do you think, Samara? Why is that the case for us?
I mean, it is complicated and it is simple. Many people of color are essential workers. Many people of color have like a turbulent relationship with healthcare and trust in different mandates because of our history, because of slavery, because of different clinical trials that have been performed on Black and Brown people, unauthorized, unethical, not being told the full truth and being able to consent in an empowered way. Many of that bias has been passed down through generations, and people don't always believe what they hear about medical information, about prevention. I also feel like what we talked about last week, many homes are multi-generational, and so when you have, children in home that are still going to school or that are around other, children where there are risks, there are people in the beginning of the pandemic who weren't having their children wear masks. And so I think that that's going to impact things. I also think about the risk that we have for some Black and Brown people who may not have access to some of the things that can prevent the spread. So when you talk about decreasing your exposure, are you able to have your meds delivered? Are you able to have your groceries delivered? Do you have access to a car where you can go and pick certain things up through drive-through without having to go in? These are things that make it harder. And I also feel like I have heard from countless people, white and Black and Brown people, who have gone to ERs, especially during the height of it, who were turned away. And so they maybe weren't tested, or it took so long to get test results back that they continued with their life feeling like, I'm going to hope for the best. But that's not realistic, But I also realize there are real life things that need to happen to keep a family and a home going, especially if you're a single parent, especially if you are an elderly person who may not have someone else to come do things for you. You have to go out and you wear your mask and you hope for the best. But there were many people who fell through the cracks of our healthcare system that I think also spread the virus. And I also know there were people, white people, who honestly I feel took their privilege for granted. Back home, we're from Pennsylvania, and in our area, there was a doctor who'd been traveling overseas who came back. He was a pediatrician. He did not self quarantine. He saw patients for a full 2 days. He was positive and asymptomatic, and he potentially impacted 250 people. He saw many clients, staff, and he was positive. And so the virus began to move throughout the county and throughout that children's health system. It's the number one health system in that area. So it impacted many people. And so my thought was, that was negligence for this person not to come back and self quarantine. So I also feel like there are people who haven't self quarantined. Maybe they felt like they um, couldn't afford to, or they didn't have that option. And some people also, I think, in the beginning minimized COVID. In the beginning, because of certain leadership, political leadership, people were saying it was a very bad version of the flu. So many people thought, well, I've had the flu, i've I've pushed through, I've been okay, this is no different. And we know now that that was faulty thinking about it.
Yeah, absolutely. One thing that I'm curious about, if you're seeing this in your communities, in my own personal family, uh, I have my father has continued to just kind of hang out with his friends. And I've seen that with some of my uncles. Not that it doesn't happen with women, I'm sure it does, but there seems to be this sort of invincibility myth going around in certain communities, particularly my community, that, oh, we're fine, we're good, none of us have it, we're good, we can all continue to hang out, we're fine.
Young
And
people too. Young people too. Some young people.
as a young person, not all of us,
Yep, some.
but particularly the college age community, we're seeing spikes in Providence, Rhode Island. I'm just reading an article about it. There's one particular neighborhood where all of the students from Providence College live. And that neighborhood has skyrocketed in cases. And there's another neighborhood where students from another university live, and that neighborhood has skyrocketed. But the remainder of the city has had pretty low rates. But yeah, there's this sense of it won't happen to me, right? That seems to, I mean, of course, it's extended past COVID. And I guess we can talk about some of that too, in terms of everything from, STIs to other diseases. There seems to be this feeling, especially in certain parts of the community, that it would never happen to me, right? I couldn't catch X disease or Y disease, not me. And that's how we have, these huge pockets in some parts of the United States, um, looks at Atlanta, Georgia, that have these really high cases. I mean, the entire United States is really high STI rates of diseases that people just assumed for whatever reason they wouldn't get, even though none of us are immune to any of these things.
I hear you 1,000%, and you're so on point. A couple things I think that one you hit on, there's this idea of invincibility. It happens with so many populations, but it also happens with Black and Brown people. There is a high STI rate in elderly people, and many of them feel like they have lived their life, they shouldn't have to succumb to certain rules. They feel as though they're okay. Like you mentioned with young people, it's not going to impact me. That's not the case. It's not the facts and it's not the science. I will say so many things are mindset. In many ways, grew up believing, from my grandmother to my mother, that prevention is worth an ounce of cure. But so many people do not see it that way. I feel like, if we can prevent certain things, we are better off. Some people feel like if I get it, I get it, and I'll treat for it. Other people, I do believe, really embody your theory, Lexi, around I am invincible. This is not going to happen to me. It happens to other people, does not happen to me. And that's magical thinking. In therapy, we would say that's magical thinking, that there's no Easter bunny coming out behind the door saying, oh, you were chosen to be invincible. That's not how life works. And so we can be proactive in treating for things. The other thing that I also believe that you hit on that's really important, two things, but the one I'll mention is I think there is sometimes shame around getting treated and how people will be treated when they go in for services. I know we live in a predominantly white area. And so when I went in to my GYN this year, just to talk about some things, just to talk about my age. We are thinking about, maybe having a second child, maybe not. I wanted to go out and just explore my options. So personally, I have a history of migraines and some neurological issues from an old car accident. And so I take certain kinds of medication. I take Botox for migraine and some other medications. And I had done some research, but I wanted a GYN's opinion on these medications, if they could be safe in pregnancy or not. And so what I found is that there were so many, it looked like early 20 something white women in that waiting room. And I remember thinking back to our time in Pennsylvania where we lived for 16 years, where I had my daughter and made frequent OB office visits. I had never seen that many 20 something black and brown women and in waiting room. And it was, I mean, there were probably 12 young white women in this waiting room. None of them were pregnant, none of them, I mean, that you could see. And then it was a long, long visit for many reasons. Like it was a long, it was kind of in the middle of COVID. A few doctors were working from home, so only one doctor was in the office seeing patients. So the visit took almost 3 hours. And in seeing these women come and go, many of them, as you could hear, had come for just their annual visit. And I say this to say, I have worked in health clinics as trauma therapist and addictions treatment therapist, and I had never seen so many Black and brown people at one time in a waiting room. And it really, I thought about that. And I even thought about myself in my early 20s. Did I go to the GYN every single year? And the truth is, I wasn't. And I know everyone's situation is different, and some people are sexually active and some people are not, and there's no judgment. But I do feel like this led to a conversation I was thinking about when we talked earlier with Elle. I wonder if Black and brown women sometimes feel as though the OBGYN staff, like the environment, I wonder if there's a feeling of safety. These women in this waiting room seem to feel very safe. They seem to feel very pleasant. Many of them were booking their next year's annual on that day as if it were just a nail salon visit. And I really felt like there was a great sense of comfort. And I felt fine going and talking about what I needed to talk about. But I thought back to my 20-year-old self, if I had that same experience. And the truth is, I didn't. When I did go, I had challenges in my younger days, just with my cycle and pain and so many different things. And I would go pretty regularly for treatment. And the fix all for everything was birth control, and they never seemed to explore any other option. And at 18, I was told by a white GYN that I probably couldn't have kids naturally, that at some point, if I could afford IVF, that could be an option, and to stay on the pill. And this was based on one blood test around some levels. I remember she did not even go over what the levels were or anything that could improve the levels. She diagnosed me with PCOS, and that was that. She said, I've given you 12 refills. I'll see you in a year. And I remember leaving, crying in my car for 2 hours. I was devastated. I felt like there were no other diagnostic tests that showed any kind of complication as to why I couldn't have children. And I felt like that was a really heavy diagnosis to share with 18-year-old young woman, and offer no plan ahead. I wasn't, of course, trying to have children at that point in my life, but the conversation was traumatic. And I remember like it was yesterday. Clearly, I have a 9-year-old daughter, so things worked out for me, but I did not receive her diagnosis as truth for me. And so I share that to say, I don't know if Black and brown women feel safe enough to go over their history, to share kind of where they are medically, where they are socially, where they are in their sexual relationships. And I feel like that does impact their treatment. I also feel like that same lack of safety can also impact folks dealing with COVID. I know of friends, of clients, of their families who talk about my person went to the doctor, shared their symptoms, they were told to go home, to take this, to stay quarantined and hope for the best. And I've heard other people who have been white people who have been admitted, who have been observed, who had not been sent home to figure it out on their own. I also know at the height of this pandemic here, medical staff and hospitals were at capacity in some ways. Yes, that's true. But I also know Black and brown people are in danger of receiving lesser treatment even when we're not in a pandemic. So I feel like it's interesting that we have a lower number of Black and brown people in this country, but the highest rates and the poorest outcomes of this disease. It doesn't feel like a coincidence.
I agree. I think I totally agree with everything you're saying. And to talk about, places of safety, I can tell you as a woman in my 20s, I've been to many a gynecologist, and I think I've maybe liked one. I mean, not even just liked, but felt as though I was being heard. Um, I will never forget as a teenager, maybe 13 or 14, not even in a gyno's office, but in my primary care physician's office, her asking me if I was sexually active. And I told her no. And she didn't believe me. And I don't know if it's because I was Black or because of the way I was shaped or the way I carried myself or whatever, but she didn't believe me. She said, no, you can tell me honestly. And I was like, no, I'm not. And I wasn't sexually active at all. And it became this entire kind of point of, you need to tell me things. You need to be truthful with me. I'm your doctor. And then I was shortly prescribed birth control after that I didn't need, and I've been on it for 10 years now, 10, 11 years now. And for half of those years, I wasn't sexually active because I had a doctor who didn't believe me. And even my experiences with my gynecologist in college, I had a gynecologist who I swear it was one of the only ones that my insurance covered. It was in a predominantly Latinx neighborhood, and you would be in the waiting room for hours. And I had jobs on campus. I had classes. I couldn't physically afford for half of my appointment to continue to sit there and wait. I had to go make some money so I could go buy this damn textbook for chemistry. You know what I mean? And so I ended up missing a ton of appointments because I just don't have the time to wait. I'm supposed to be in at 9. It's 11:30 and I'm still sitting here. It was outrageous. So I totally think what you're saying could be the case for people more than myself. I've never felt entirely safe and heard in a feminine health setting until very recently. And that was after, really searching for someone that would hear me and would work with me through my particular health needs. I have some weird things to deal with hemophilia that make my periods absolute nightmares. And once again, I had gynos who didn't believe me that was even a side effect of my form of hemophilia. And that, birth control doesn't work. Like you, I was prescribed every birth control on the market to try to solve an issue that has nothing to do with it. But yeah, I think that's a journey, unfortunately, that a lot of us face for whatever reason. And I think Q may be back. I can't tell. It looks frozen.
Yes, there you are. I picked up on what you guys were talking about, and it is for me, since I just had my baby 8 months ago, this whole issue of birth control, not feeling safe, I have opted out of the healthcare field other than going to the gyno once a year to get my pap smear. And I just found out, I think last year, that now they make it so that it's every 3 years. So I was just like, what? So I'm just like, okay, why is it not every year? But I haven't been on birth control since I was 19 because I went through the gamut of all of different ones. Like Depo, I spotted forever. One made my migraines absolutely unbearable. I had another one that I lost weight and I didn't have an appetite. And I was just like, yeah, we just gonna opt out. And then when I went back for, I think this was like the fourth one that she was trying, and I just told her like, hey, I don't want to do birth control anymore. And I was in college, and so she was just like, you're in your second year of college, you should definitely. And I'm just like, I'm not liking these side effects. Like, it's been almost 4 years now, and I've gone through every one that you can give. So even though I told her no, I walked out the doctor's office with the ring, whatever, and it was crazy because I didn't use it, but I think it was like a year and a half later that was recalled about having issues with uterine issues. And I'm just like, if I would have took this medicine like she pushed me to do when I told her I didn't want to, I could be a part of this recall. And it's just, feeling as though you have no voice, or that issue of I'm a professional, so I know better. And then, with the statistics of Black women in dying in childbirth, that was the scariest thing for me, because it's like I've made sure that had to be in this setting other than the once a year when I just get all of the tests ran. But now I'm going to the doctors literally every month, and down to the last every 4 weeks. And I was considered high risk because I was 35 and it was my first time pregnancy. But it was just like all of the stuff that they were pushing, and I'm just like, I'm good. I don't want that. And they're like, we got to run this test. Like, I had to take the diabetes test 3 times because I was just like, and I almost got to the point of, I took it the third time only because the pressure of the doctor, like, well, if something's wrong with the baby and diabetes and preterm labor. And I'm just like, dude, I have done this test 3 times. Leave me alone. So it was just like, I took it. But then one of my friends, that's the nurse, she told me, she was like, after you took it the second time, there was no reason for you to have to take it a third time. And I'm like, well, she made me feel like my baby was going to fall out of me if I didn't take it the third time. So it is a very prevalent thing in the healthcare and community, that you feel like your body, but it's not being listened to because they went to school. But I got to get my little guy. He's screaming.
No worries.
Go for it. Family first, always. So, Samari, can you talk a little bit about the relationship as someone who is, in this realm, the relationship between the knowledge of you as an experienced, licensed, trained professional and, my knowledge as a person who knows my own body, mind, and spirit. Tell me about that relationship and the best way to balance that, to make sure that everyone's being heard in a kind of a client, therapist, doctor relationship.
For the person, always trust your gut. You can be open to hearing a professional's feedback and their knowledge into your situation. But as Q was saying, I think it's so important to trust your gut about your body, your mind, your what's best for you. It's a little different with addiction because of the nature of addiction. Addiction lies to people and they feel like I can manage it, I can do it on my own, I can get clean on my own. You really do need support when you're healing addiction and when you're healing your nervous system. Even when it comes to mental health, it's so important to have a team that you trust, but trust is the operative word. I've had so many patients who have said, I stopped going, I stopped being treated because I did not trust the doctor, the therapist, the psychiatrist. They were not hearing me. So in situations like that, you do want to trust your gut. Feel like you're not being heard or not being honored. And one thing that Q brought up, it's certainly a crisis when it comes to Black women and maternal health. I think you have to trust your gut when it comes to what's best for you. And if something's wrong, if people are telling you like It's not wrong. It's in your head. Do not believe that. Keep seeking out professionals who are going to hear you and believe you and help you to find the answers. It's so important. Even with this COVID situation, I feel like sometimes you may have to go to a different hospital, a different doctor. You have to change doctors. You have to go to a different ER. But if you feel something is wrong with you, be the squeaky wheel and keep seeking out medical attention, maybe even holistic treatment to help with whatever you need for it. So many Black women are losing their lives and losing their children when it comes to maternal health because they're not being heard, they're not being listened to. And what Q brought up is so true. I really feel like doctors, hospitals have to pay exorbitant amounts of malpractice insurance to be able to practice. It's gone up exponentially over the years because we are so easy to sue, but there are so many mistakes that happen that are warrant people being sued. What happens though is people that have insurance are gouged. 35 years old, I'm not a doctor, but without a complicated medical history, there's no reason to go to the OB every week in pregnancy. And that to me screams red flags. It screams insurance fraud. It screams wanting to milk people that have good insurance who will pay high amounts. Back to the doctor and to the hospital, and there's a fine line. There is something about being safe than sorry, but there is also excessive treatment. And I've also had chronic things that I've had to say, no, I'm not doing that. No, I'm not having that surgery. No, I'm not taking that medication. No, I'm not doing this. And asking questions. Why are you ordering this? Why do you feel this is better versus this? When I know my body. So there is a fine line for every person. There is something about someone who's medically trained who can tell you why they're prescribing something, why they're ordering something, why this would be a benefit of you. But I also think there is real value when a doctor, a professional, a therapist, psychiatrist says, these are the two options. Why don't you go home and think about it? Give us a call back with what you decide, or we can schedule you for 2 weeks and you can come back in and we can talk it through. We don't have to decide today. No, honestly, it's life or death. If you need to go to rehab today, if you need emergency surgery, if your baby is literally in risk, that's a different conversation. But for many conversations around birth control, around preventative measures, with COVID, the flu, pneumonia, different chronic illnesses where there are different treatment options, I value providers who say, here's all the information on the table. What do you feel is best for you? Do you want to get a second opinion? How do you feel about this? When you find a professional who's willing to listen to you, definitely honor that relationship. And I will add, it's always, always, always a good idea to get a second and third opinion. Most insurances, commercial, Medicare, Medicaid, state-funded insurances, they all will pay for second. You go to the same doctor with the same diagnosis, they will pay for the evaluations usually. You can always call your insurance company to find out what specifically about what's happening with your insurance, but it's always a good idea to get a second opinion to see, does this information cooperate the other doctor's opinion? Did this new doctor give me new things to think about what's happening with me? But it's important to trust your gut, to trust your medical professional. If you don't trust them, find a new one. It's worth the hassle. Call your insurance. You can get referrals of doctors, psychiatrists, therapists who are in your network. And if at all possible, if you have a complicated issue or like an ongoing thing like pregnancy or diabetes or something where you're going a lot, if you can have someone go with you, it can be important to have an advocate to help you because there are things that you may not think of. They could help you take notes. Having someone with you can act as a support because the medical system in this country can be overwhelming.
Yes.
You know, my entire life, I don't think I've ever had a physician give me options and then tell me to think about it. Like, as you said that, I was like, that has never happened to
And
me
that's what I was
before.
thinking. It's just
I
the
just get
pressure.
prescribed
It's like here. And it's like even
something.
after I told her like I don't want birth control, it's like she sent me home with it. And it was just like, okay, I guess I don't have a, it's just like, here, just take this. It's never, well, think about it. It's like it's the end all be all. There are no options on the table.
And that's sad. I have had people, I've had good doctors, but I've had to seek them out. I've had to go and have multiple appointments with different doctors to find someone who could really help me with my pain. The other thing that I learned only in practicing addictions treatment is that doctors get kickbacks from pharmaceutical companies. So they
I
get
found that out.
they give incentives for certain prescriptions, for certain quantities of prescriptions, for pushing a certain medicine that the pharmaceutical company wants to push. So certain birth controls, the years ago, DEPA was like the thing. And so I haven't done research on that, but I do know in the addictions field, certain doctors were getting kickbacks on prescribing narcotics, on prescribing certain addiction treatment medication for certain brands and certain milligrams and certain quantities. And so I will say that was not common knowledge, 10 years ago. And so it makes sense that certain docs were pushing certain agendas because we were not informed as the consumer to the point where it's caused harm to the public. So we do have to be aware, and I think it's important to think about how you feel when you leave that doctor's office. If you don't feel safe, if you feel like you weren't heard, if you feel like you don't even know what this medication is really supposed to do, and the risk of taking it, I would say those are all red flags and permission slips to get a second opinion.
Well, I knew about the kickback only because one of our close family friends, she is a pharmaceutical rep. And so she goes to different doctor's offices, and her incentive for them is like lunch. That's one of the reasons why you always have nice pens at the doctor's office. So I did know that they do get incentives for whatever particular type of medication they're pushing at that moment.
And I'm not saying it's all bad, but I do think that when you take the greater good of public health out of it, it can get really dicey and really slippery.
I feel like whenever the incentive is monetary, it makes it very hard to believe that it's really in the best interest of the patient. So it's, so say for example, after I decided I didn't want birth control, she gave me a sample. And actually, she didn't just give me a sample. She gave me a 3-month supply because you were supposed to change the ring out once a month. So I got 3 free ones. And she was just like, when these are done, call me and I'll fill your prescription. So it's just like, if I would have used it, I would have became a customer.
Yeah.
And we even have to be careful when the incentives aren't monetary. So a lot of times what will happen is, and I won't name names because I don't want to get sued,
Right.
Acme Pharmaceuticals will host a wellness conference, right? And the wellness conference just happens to be in Honolulu, Hawaii, right? And it just happens to have, Michelle Obama as a guest speaker. And it just happens to have all of these great things. And it's a free trip, but it's a health and wellness conference. It just happens to be sponsored by Acme Pharmaceuticals. And they're inviting, every major physician in that field to attend. Or, the flip side, we're sponsoring white papers. Acme Pharmaceuticals may sponsor the latest white paper in, Scientific American about the effects of this medication. It seeps into a lot of different ways where it isn't an exchange of money. It isn't a direct exchange of anything, but they're involved in so many different ways. In so many different facets of the physician's lives, they're almost bombarded with it. And sometimes it's like nearly subliminal. Sometimes it's more obvious, like the Hawaii situation is pretty obvious it's happening there. where, they're bombarded with ads just as much as we are as consumers. And you think about how many pharmaceutical ads do you see on TV or even on your phone all the time. They don't tell you anything. It's people smiling and laughing and running around a grass field doing Tai Chi. Like, what does that have to do with your health? But it's always in your face, and we're always told that traditional pharmaceuticals are the answer to all of our problems, right?
Yeah.
Which we know isn't true. Sometimes it's the answer, sometimes it's the piece of an answer, sometimes it's not an answer at all. And I don't think we have any real there isn't really a good place for people, particularly women of color, to go to really find the answers to things like that. Especially if you don't have a safe place in your own, physician's clinic, to really figure out what's the truth and what's not the truth in terms of pharma and general medicine.
Agreed. Doing your own research is often helpful. You don't want to be diagnosing yourself on WebMD, but you can look up certain, forums where women will share their experience with a certain medication, with a certain supplement. You can look up this for doctors. People who have bad experiences are of course, going to post bad reviews. And not everybody that has good experiences are going to share good experience. But you will be able to get some kind of a feel for the practice and the doctor. And if you read enough bad reviews, you can also decide, maybe I want to avoid this and maybe try and find something different. You can also call your insurance company, and they can email you a list of referrals that's in network for you, and then you can look up those doctors' names on Google and find some reviews about them, just to have feedback about what your next steps are going to be.
Can I announce to you ladies, I made a big step today, actually, in my health journey. I'm very excited about it. And I know I'm late to the party, and I should have been doing this my entire life. But I just put in my first consultation to see a therapist ever. I'm very excited. Thank you. And when I tell you, I was scared as hell. And I've been thinking about it for literally years, and really thinking about it during COVID. And I found a couple of people, and I have a couple of other folks to reach out to, but I think I found someone who looks like they may be kind of what I'm looking for. Everybody cross your fingers, pray for me, whatever you do. I hope it works out. I'm nervous, but I'm excited.
I am so happy that you are doing this. I've been in therapy now for about a year, and I pray that your therapist is a first time success, because and I want to say, I'm going to say this and then say that. If you don't mesh with your therapist, don't feel bad, because sometimes it does take 1 or 2 times before you find the right one. But I pray that your first time is a good one, so you don't have to feel like I'm starting something new and now I'm going through the motions. Because I was successful in having my first therapist be a good therapist, so I didn't have to feel like, I'm trying something new and now I'm discouraged because I don't really mesh with the person, and I can't be open because I feel like I'm being judged, or I don't feel like I can say what I want to say. But I didn't have that problem, so I hope that your first experience is everything it needs to be.
Thank you. Me too.
I love that so much. I think everyone should go to therapy. If I had a magic wand, I would take everyone to therapy. It would be free of charge. It would be an amazing experience. It is so worth it. I think we all need to process just things that have happened in our life. I think that good therapy can help you go on a self journey and really get clear release some things, call in some things, get clear about what you're wanting in your life, and really shift how you think about certain things that have happened, that you want to happen. I think it's so powerful. And I think that it's so amazing that you are seeking that out at this phase in your life. I know it's going to serve you in so many ways for both of you, but Q is 100% right. It's great when the first time works and it's like a soulmate situation, but I also feel like we have to allow for grace and self-compassion. If we go to a restaurant and have a bad meal, we don't stop eating food. We just never go back to that restaurant. Like we move it along. It's the same with therapy, or doctors, or a trainer, or whoever it is. The first time match, but there is a match for you. And so I love that you're giving yourself this gift. It's the gift that keeps on giving.
Thank you, ladies. I'll tell you though, oh boy, the price point. I understand why it's taken me so long to get here. Well, one, because I come from a family that doesn't believe in mental health issues.
Yes.
So that was the first barrier. And then two, I have a general distrust of people, as I think many of us in the Black community do.
Yeah.
Outsiders. I don't tell anyone my business. It's my business.
Right.
Which is part of the problem. But three, that price tag. Ooh, it's not cute. I understand how the financial barrier is a lot for most people, I would assume. I'm by no means rich, but I feel like it better be worth it.
It's definitely a sacrifice. Like just to be transparent, my therapy is $60 every visit. So I made it every 2 weeks, and I just take it as I know that I'm going to spend this $60 on something else. So I'm going to spend it on this, because like every week was not feasible. Like what got me into my therapy was I read the book. I read 2 books, which was funny because it was actually last March when I started. So I read Shook by Charlemagne the God, and then I read a book called Queenie. I can't remember who the author is, but both of those back to back. And consequently, in the month of March, which I didn't know was Mental Health Awareness Month. So I read both of those books. And when I got finished with Queenie, because it's a Jamaican woman and she's in England, I believe, but it's her story of how her life unravels and basically how she goes to therapy, and her family being Jamaican are like, yo, what are you doing? We don't go to therapy.
Yeah.
We pray, we
Yes.
do everything, but we don't go to therapy. And so when I got to the end of that book, I was just like, wow, I just read 2 books about therapy. Do I need to go to therapy? So it was like, and then because it was a shock to find out, like, if I don't have insurance, it's $120 a visit. And I'm just like, who got that? When do you want me to go to therapy? Once a month? Once every 3 months?
That's where I am. So I have insurance, but my insurance does not cover most of therapy. So I'm around that price point, and gee willikers, is my pocket not excited. But my mental health is telling me, you know what? It's time to make this sacrifice. It's time to do it.
Yes.
It's true. It's so true. And with anything, there is a fee, of course. Many therapists, for those of you who are watching who are really on a budget, there are many therapists that have sliding scale prices for people who want to do the work. Some of them are reserved for populations, but always have a consult with a therapist and see if they offer a sliding scale fee. But I do love the point that you made, and this has been true for myself. It's been true for many of my clients. We make room for certain things in our budget, and I often feel like we spend so much more time and money on the broken parts of our life than you would in therapy to fix them and to move forward. Therapy does not have to be 10 years or 5 or even 2, honestly. It can certainly be, but it doesn't have to be. And I think that the investment really is the gift that keeps on giving. There are many insurances that do help with therapy. There are many that don't, but many therapists will accept your copay as payment. So you can ask. Sometimes it's not offered, but if you ask, they will let you know what their policy is. And certain therapists just hold certain lower price points for certain people, single moms, young people, the LGBT community. Everybody has the community that they're trying to support to get access to those who need it. There are other foundations who in this pandemic are helping with some free services for folks who really do need that. So Google free therapy services for Black women or for teens or for college students. There are services. Every college has a mental health department that's included with your tuition. So use that if you are in school. That's a beautiful service. But I would also encourage people to know, just like what Queen is saying, what Lexi is saying, you owe it to yourself to do what you need to do for your mental health, because it is that serious. Just like with physical health, when we leave things unattended to for so long, it can create so many other problems, physical health problems, emotional health problems. The mind-body connection is real. And when we do not take care of our mind and our emotional health, believe me, it seeps into other areas of our professional, our money, our parenting, our relationships, just how we show up in our life. So the commitment to mental health is one that we'll come back to so many times over.
Absolutely. So I'm very, very excited, and I will, of course, keep this group updated over the last few sessions that we're doing about what the experience is like. But yeah, I think what you're both saying is absolutely correct. I do have to understand that I should be patient. This will be a journey, not a sprint. I tend to be a very results driven person, and I need to not be that person right now.
No, slow and steady, slow and steady, slow and steady. And if you leave crying and feel like your life has been burst in a million pieces, go to the next session.
We'll see. We'll see. I will do my best. I promise I will do my best to make this work. And I'm really excited. I'm really excited about it. And in the analogy both of you are saying is completely right. Like, I go to the doctor every year. I see my gyno every year. I, work on my nutrition. And I mean, I'm terrible at working out, but I try to do that. So why haven't I been working out my brain, my spirit, So it's the right time. I'm very excited. Ladies, we only have a few more minutes, but I'd like to give a shameless plug to anyone and everyone watching that we have a fantastic debate coming up very soon. And for those of you who are like me and don't own a television, guess what? YouTube streams it on their CNBC channel, and I think the ABC channel streams on YouTube. So please go and watch it. Get involved in your political process if you haven't already. We say this every episode. I'm going to keep saying it until the very end. If you're not registered to vote, register to vote. Vote. Early voting in a lot of places around the country is available. Mail-in ballots in a lot of places around the country are available. I don't care how you do it, but get ready to vote and vote. Do it now or do it on election day. Vote, 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 and stay informed. Oh, look at this beautiful baby. Look at this baby. Let's give a shameless plug to Q's little love muffin. Oh! Oh my God. What's your baby's name?
Axel.
Oh my God, baby Axel. Oh, hi. See, this is why you vote. You vote for the beautiful babies of the future. The future of America is Axel. So please go out and vote. Watch the debate. I'm very, very excited to see Kamala Harris kick butt tonight. I mean, whatever. This is biased. Bias the House. but I'm very excited to see her be represented. I'm excited for the first time in my life to see a woman who looks like me on a stage so grand for such an important moment. I can't wait. And I hope that everyone's going to watch it tonight too. And if you don't do it for you, do it for the baby Axels.
Yes.
And on that note, I think it's a great time to wrap it up. Thank you again, ladies. Once again, it's been fantastic. This has been To Be Black and Female, brought to you by the Luv Table Company. Thank you again, Elle. Thank you again, Dylan, for bringing us all together. Thank you, baby Axel. Thank you, Q. Thank you, Samara, for your great insights and wisdom. And have a great night, everyone. Goodbye.
You, Lindsay. Bye.
Bye-bye.